Hello, my name is Troy Rohn, and I'm a faculty member in the Department of Biological Sciences at Boise State University. And one of the things that I do besides teach is I also have a vibrant research program in Alzheimer's disease. And not only do I do research on Alzheimer's disease, but I also give talks out in the community about what Alzheimer's disease is and why it's important that we educate the public about this disease. And so today I would like to spend a small amount of time educating you about the Alzheimer's disease. Alzheimer's disease right now, there are over 5 million Americans that have Alzheimer's disease, and that number is going to triple by 2050. Not only that, one at every 70 seconds a new person's diagnosed with Alzheimer's disease in the United States. It's currently the 6th leading cause of death in the United States. And I remember when I first started at Boise State in 2000, it was the 12th leading cause. So it's already moved from number 12 to number 6, and that's all deaths in the United States. Beyond that, it places an enormous burden on our healthcare society. So I talked about my students is that it's very important that we develop better treatments, because what's going to happen is as the number of Alzheimer's cases increases, more and more money is going to have to be spent in the healthcare system to support that. Right now, we spend about $150 billion a year to support people with Alzheimer's disease. That number is going to go up to $1 trillion by the middle of the century. Simply put, it's been projected that this disease by itself will completely bankrupt the healthcare system unless we come up with better treatments. And so we all have a vested interest in this disease, not just from a personal standpoint. Everybody knows somebody who has had Alzheimer's disease, but from a societal standpoint when we talk about our health care. So if we look at people that are dying from Alzheimer's disease and we compare it to other major causes of death in the United States, cancer, stroke, all these diseases have shown a decrease in the number of deaths from 2000 to 2008. Alzheimer's disease, on the other hand, has shown a dramatic increase. There's been a 66% increase in the number of people who are dying from Alzheimer's disease since 2000. So again, there are many reasons why we need to have a vested interest in this disease. So what is Alzheimer's disease? Let's talk a little bit about what Alzheimer's disease is. This is a progressive neurodegenerative disorder. And what do I mean by that? You don't wake up one day with full-blown Alzheimer's disease. It takes years for the symptoms to occur, and the disease has a long, insidious process. So that's what we mean by progressive. It's neurodegenerative. And what do we mean by that? It affects a class of cells in the brain that we call neurons. Neurons are very special cells. They're the cells that are able to send electrical signals and basically to tell our body what to do. And more importantly, neurons are special because they no longer have the capacity to regenerate. So when you lose neurons, you lose them forever. You're basically born with a set. And that's why I always tell my students, you're 20 years old, you're experimenting, but you got to be careful of what you're doing with your brain, because you got to take care of those neurons. And in Alzheimer's disease, what we see is that these individuals lose neurons, and they lose neurons in areas of the brain that affect memory and cognition. And so that's why people that have Alzheimer's disease display symptoms of memory loss and other higher cognitive functions, such as language, problem solving, etc. Is Alzheimer's disease dementia? And what is dementia? And what I say is that Alzheimer's disease causes dementia. So dementia is the loss of cognition, the loss of memory, and an intellectual deterioration. And Alzheimer's disease is by far the leading cause of dementia in the United States. But there are other ways that you can get dementia. For example, you can get what's called vascular dementia, which is caused by a lot of mini strokes that occur in the brain. But regardless of the type of insult, it all leads to the same symptoms, i.e. dementia. So Alzheimer's disease is by far, 70% of all cases of dementia are caused by Alzheimer's disease. So to understand Alzheimer's disease, one of the things that we have to do is understand what's happening in the brain. The brain is a very complex organ. You have 100 billion neurons right now in your brain. And to put that in perspective, that's the same number as the number of stars in our galaxy. So there's an enormous number of these neurons. And what they do is they function primarily by communicating with each other at points of connections that we call synapses. And there are over 100 trillion synapses in the brain. So this is a very complex, dynamic organ. And what we see in Alzheimer's disease is that these neurons are lost. The synaptic connections are lost. And Alzheimer's disease basically affects these neurons. And remember, these neurons, once they die, they don't grow back, okay? So that is probably the overriding feature in Alzheimer's disease, is a loss of neurons. And we can actually measure that simply by brain mass. If you look at someone who has severe Alzheimer's disease, their brain may literally weigh 50% less. In other words, they lose up to 50% of their brain mass during the course of the disease. So it's no wonder why they have the symptoms that they do. We can actually visualize this loss of neurons as a loss of brain activity. For example, there's a very common procedure to measure brain activity. It's a PET scan, and what it does is it measures brain activity and it gives you an image of the brain. If you have, reds, yellows, that's really good brain activity. Well, if you compare, for example, a normally aged 80-year-old person with somebody with Alzheimer's disease, what you'll see is the person with Alzheimer's disease has a dramatic reduction in brain activity. And one of the things I like to do is when I talk to students, not only do I like to compare somebody who's normally aged, an 80-year-old with Alzheimer's disease, but I also like to throw in there a 20-year-old. And what's remarkable is that if you compare a 20-year-old, their brain activity, with an 80-year-old, there's very little difference in brain activity. And what I try to do to my students is say, hey, look, just because you're old doesn't mean that you don't have good brain activity. And furthermore, I tell them that those neurons have probably been around 60 years more than your neurons. So we need to respect our elders. It's the bottom line. But again, to get back to Alzheimer's disease, we see this loss of neurons, and we can see that histologically. If we just look at the brain, we see that there's a dramatic reduction in the outer layer of the brain. This is called the cerebral cortex, and this is the area of the brain that really separates us humans from other animals. Is this part of our brain is highly evolved, and this is the part that's heavily hit in Alzheimer's disease. We can use an MRI, for example, to document this very clearly. If you compare an MRI scan with somebody with severe Alzheimer's disease, you see a dramatic reduction in the brain volume. And basically what this is reflecting is a loss of neurons. So this is why people get Alzheimer's disease. And what we want to understand, though, is why people get Alzheimer's disease. What are the molecular players involved? And that's kind of where I want to go next. So I've kind of talked globally about the brain, the entire brain, talked about a little bit about the neurons, but now what we want to do is look at the microscopic level and try to uncover what are the troublemakers in this disease. And basically, if you were a neuropathologist and someone you suspected died from Alzheimer's disease, you would basically have to find two microscopic markers. And what I want to do is talk about these two microscopic markers today because, first of all, it will give you a better understanding of the disease process. But more importantly, the reason why I want to talk about these troublemakers is that if you want to know what's going on in clinical trials today, you need to understand what these troublemakers are doing. And so many of the strategies that are underdeveloped are attacking these two troublemakers that I'm going to talk about here in a second. Okay, what is the first thing that you need to be diagnosed with Alzheimer's disease are what we call neurofibrillary tangles, or tangles for short. And as the name suggests, a tangle is a neuron that has lost its shape. neurons, the shape of a neuron is very important for its function. And you can imagine a neuron that becomes twisted and contorted can no longer communicate with other neurons. And so when we think about a tangle, this is literally the neuron losing its shape. And the question then is, why do neurons become tangles? And basically what happens is that the framework of the neuron breaks down. Just like your house, you have 2x4s, 4x8s, and if those structural elements break down, your house breaks down. Same thing with the neuron. In the neuron is a certain scaffolding, the framework, and a very important molecule for that is a molecule called tau. And the best way to describe how tau normally operates is if you have a railroad track and you think of the steel rails, the little wooden planks that are in between, that's tau. And what tau's doing in the neuron, it's helping stabilize the railroad tracks. And you can imagine what would happen is if you lose those wooden ties, your railroad track is going to buckle and lose its shape. And that's exactly what happens in the neuron. Tau no longer operates properly. It begins to lose its function, and the neuron loses its framework. It becomes twisted and contorted, and it eventually dies. So that's the first thing that you need to be diagnosed with Alzheimer's disease are tangles. The other microscopic troublemaker that you need to have to be diagnosed with Alzheimer's disease are the senile plaques. So what are senile plaques? Well, if I told you, go in the kitchen, here's the recipe to make a plaque, the most important ingredient would be a molecule called beta amyloid. Beta amyloid is a small molecule that's very toxic, and a lot of research has gone to try to understand what beta amyloid is and why it accumulates in Alzheimer's disease. And when we talk about what beta amyloid does, is it basically accumulates and begins to form these plaques, just like plaques on your teeth or plaque in your coronary arteries. It gums up the works. And beta amyloid is a major ingredient in these plaques. It's toxic. If I were to grow neurons in the laboratory and sprinkle beta amyloid on top of them, it will kill these neurons. So not only does it build up, it's very toxic to neurons. And so a very central question in the field of Alzheimer's disease is, why do people with Alzheimer's disease get a buildup in beta amyloid? Well, we think we've uncovered why. And it's actually a process that happens not just in people with Alzheimer's disease, but normal individuals. The beta amyloid fragment is derived from a precursor molecule called the amyloid precursor protein, or APP. And normally this molecule is in all neurons, and it kind of sticks out of the neuron like this, so it may act as some sort of receptor, if you will. But like all molecules in cells, it gets old and has to be replaced by new APP molecules. And that happens by the fact that you have proteases, or molecular scissors, that come along and clip the APP molecule. But in the process of doing that, they form a smaller fragment that is beta amyloid. And what we think happens in Alzheimer's disease is that this process runs amok, and that the production of beta amyloid overwhelms the ability to get rid of it, and it begins to accumulate, and it begins to form these plaques. And so this has become called the beta amyloid hypothesis. And what this hypothesis stipulates is that beta amyloid is basically the match that lights the fire. It's the first step in the entire process. And it ultimately leads to the tangles that then ultimately lead to cell death, and then you get symptoms of the disease. So very importantly, the reason why I've tortured you for the last 5 minutes is that many of the drugs that are presently in clinical trials, and there are over 60 different clinical trials going on right now, many of them are targeting beta amyloid, either to stop its production or to stimulate its removal. And so we're optimistic because these drugs represent what we call disease-modifying drugs. Currently, we have no effective treatments for Alzheimer's disease. Basically, we have the equivalent of, here's your aspirin for your headache. What we need to do are to get drugs that directly target the troublemakers, i.e. the tangles and beta amyloid. And what's very interesting about beta amyloid is we now know that it begins to accumulate years or even decades before symptoms manifest. So if we had a way to stop the production of beta amyloid, you're talking about a very effective treatment strategy. And if we look at beta amyloid and the plaques and tangles, how they progress during the disease process, it all starts out in an area of the brain called the hippocampus. And this would be, the hippocampus is important because this is an area of the brain that's very important for memory. And that's why people first present with memory problems, is the earliest known symptom is memory loss. And that's because that's where the plaques and tangles first attack. And you begin to lose neurons in this area of the brain. And again, this happens very early on. Well, what happens then is that the plaques and tangles begin to spread. And they begin to spread in other areas of the brain. And this is when you will begin to exhibit a patient that may have mild to moderate levels or signs of Alzheimer's disease. So in addition to memory deficits, you may have a patient that may be confused, they have trouble, poor judgment, they may show mood changes, and finally, the disease will progress to what we call severe Alzheimer's disease, where now you're affecting the cortex, the entire cortex. It's like it spreads like a fire. And in this case, in severe Alzheimer's disease, most of these patients cannot do the most basic living tasks. They have to have help feeding, being fed. They have to have help changing their clothes. At this point, they probably won't even remember family members. And you know what's really devastating about this disease, it's the last stage of the disease where patients will spend the majority of the time. 40% of the entire course of the disease is spent in the last stage, where patients have to be hospitalized or put into assisted care living. And of course, this is very difficult for family members. At this point, most individuals who have severe Alzheimer's disease usually die of some factor related to the disease. The most common cause of death in Alzheimer's disease is actually pneumonia. And what happens is as individuals progress, they lose the ability to swallow, they become very immobile, and they suffer from malnutrition, and they actually can get infections in their lungs. As they forget to actually swallow their food, it becomes abscessed in their lungs, and they get pneumonia. And that, in fact, is the most common cause of death in Alzheimer's disease. So can we determine whether or not someone has Alzheimer's disease in the living, if someone is alive? The answer is no, we can't. Right now, there's nothing that's approved. There's no test that one can take to actually says that you have Alzheimer's disease. But we are finding techniques, brain imaging techniques, that will allow us to actually see the beta amyloid in living subjects. And this is going to be very important because it's not only will it allow for early detection, but it's going to allow us to determine whether or not disease-modifying treatments are having an effect. And I believe that this technique of being able to image beta amyloid in living subjects will be available probably within the next 5 years. It's very close to FDA approval, but it's not there yet. So what are some of the current research goals as a community? Well, we're really focused on early detection and prevention. As I mentioned, the disease can be triggered very early on, years before symptoms manifest. We need to find a way to screen these people earlier. We need to get candidates earlier for clinical trials. We've seen 3 or 4 failures in clinical trials based on beta amyloid hypothesis. And I believe one of the reasons is that these people were just too far along. It's kind of the horse is already out of the barn. There's no point in closing the door or getting rid of the beta amyloid at that point. So we need to be able to screen people earlier. We need to have disease-modifying treatments, those that attack beta amyloid and those that attack tangles. And I should mention that we don't need to cure the disease to have a significant impact. If we can simply delay the course of the disease, we can have a tremendous impact on this disease. For example, if we can delay the onset of Alzheimer's disease symptoms by 3.5 years, this would reduce the Alzheimer's disease prevalence by 1/3. So we can have a really powerful effect simply by delaying the course of the disease. Not only that, but by delaying Alzheimer's disease, we can have a tremendous impact on the care of individuals. That is, we can allow these individuals to stay home during the course of the disease. This is a very difficult aspect for caregivers and family members. It's not only cost prohibitive, but it takes an emotional toll to put these individuals in assisted living care situations. Well, if we can delay the onset of symptoms, we can allow these individuals to live the course of the disease at home, and I think that will have a tremendous impact. Are we there yet? No. And this is why it's important that we educate the public about what we're doing as far as research, but also educating the public about what Alzheimer's disease is. This is an epidemic on the horizon. And so I thank you for the opportunity to speak to you today about Alzheimer's disease. Again, my name is Troy Rohn in the Department of Biological Sciences at Boise State University.